I'm Dr. Morar. I'm an interventional radiologist. I finished my fellowship from the Cleveland Clinic in 2005 and then started practice here in the Dayton area. I'm locally from Dayton. I went to Centerville High School, graduated in 1990, and then went on to medical school, did a general surgery internship in Detroit, and then did radiology residency in Detroit, and then a vascular interventional radiology fellowship at the Cleveland Clinic. And came back to Dayton for several reasons. Most importantly, my family. My wife is from Cincinnati. We both went to Cincinnati, the University of Cincinnati. We're both Bearcats. And our entire family, the entire extended family, is in the Dayton, Cincinnati area. I grew up in this community, and we were excited about coming back home. And that's half the battle in anything that anybody does, is to make sure that you're socially sound and you're happy, and usually for most people happiness comes wherever their family's hanging out, and that's true for us. Passion for interventional radiology is kind of a unique story. As a medical student, you do a lot of rotations in different subspecialties. There's not really a rotation for interventional radiology in medical school, but there's a lot of rotations where you go to the radiology department. And I think I was doing a medicine rotation, and we went down to radiology, and there was this doctor in a lab. His name was Dr. Savan. He was putting in a filter. Filter is this device that we put in to stop a clot from going into the lung and potentially killing a patient. And he was able to put this filter in without any major surgery. He put it in through a little puncture that he made in the vein in the leg, and using his x-ray camera, he used a little nifty catheter and just kind of like a little snake in a wire. He was able to deploy this filter, which was about this big, into his vein, and it was done in about 5-10 minutes, and the patient was completely awake and had no pain. And that was my first glimpse of what interventional radiology it was all about. So my passion for interventional radiology comes like any other doctors. There's a crossroads in a person's life that they come to, and there's a realization moment. It's kind of like falling in love with maybe your spouse, and you just know within your heart of hearts that this is the right calling for you in your life. For interventional radiology, it's just the perfect blend. It's revolutionary, and very few times in medicine there's going to be a field where you are so blessed to have all of these factors, where you get to have patient interaction. You're at a very critical point in a patient's life, in their disease process, where you can really affect change, and you can do so without having to put them at undue risk, and that builds passion if you're a passionate person. And to be able to do this in Dayton, Ohio, where this is home for us. So there's that. That's what we live for, is to be able to live in a community where you can get that kind of gratification. And for me, interventional radiology does all that and then some.